Hello, I'm Harriette Van Spall, Associate Professor of Medicine from McMaster University, and I'm thrilled to have Dr. Roxana Mehran with me.
Hello, Harriette. Dr. Van Spall. Nice to see you.
I'm super excited that we're going to chat today about running clinical trials and what it takes to be a successful trialist, and perhaps get your comments on why it is so unusual to have women principal investigators of our large cardiovascular clinical trials.
Well, it's really a shame that there aren't more women doing this, because it really is such a fulfilling, wonderful, wonderful career in clinical trials. I mean, think about the impact that we make, and you do, and I think we do, when we answer a research question by performing a well-designed clinical trial. So for me, it's one of the most exciting areas, and I think the impact goes beyond the office space of just a single patient that you see in your office or in your cath lab when you're performing a procedure, but it goes beyond that to the population at large, especially if the research question is significant. Now, you yourself have had a lot of great training and working from such an incredible institution at McMaster with such great mentors. And we know that it takes a village, right? It's hard.
Absolutely.
We all have clinical responsibility. Mm-hmm. We have home lives. We also want to publish, but at the same time, designing and running a clinical trial is a whole different animal, I call it, right? Because one, you should really have a lot of training. Now, you have had some formal training. I learned it on the street. So tell me about that.
That's amazing. I didn't know that.
Tell me about that, yes.
Well,
so tell me about your formal training and what it took to do that.
Well, I love research, and I think that if you're curious and analytical and enjoy answering questions to further the field on a large scale, as you alluded to, there's no way around it. And whether or not you run a clinical trial, there is tremendous excitement in answering a research question. I did undergo formal training. I mean, I did research all through my internal medicine and cardiology clinical training, but then I went off to do a master's degree at the Harvard School of Public Health, and I came back to McMaster and did a research fellowship so that I had the skill set to conduct clinical trials. I would say that there are some barriers that women face in the competitive field of clinical trials, particularly since this type of research methodology requires a significant investment on the part of mentors and sponsors. There's also funding requirements without which it's impossible to run a large-scale study. And there might be implicit and explicit biases in our system and in how we view women who have some of the characteristics that are required to be successful at clinical trials and at clinical research. What are your thoughts on some of these obstacles and biases that women face, and do you think that these are deterrents that explain somewhat the gap that we see between the proportion of men and women leading clinical trials?
Yeah, no, I mean, I think there is no question that the biases are there, whether they're implicit or not. Some we've seen blatant biases that have been there, but I do think that it's extremely difficult, and in this particular arena of cardiovascular disease, where we see that our own subspecialty of cardiology is so not family friendly, we need to kind of change that conversation, that narrative towards a more family friendly, more sharing, etc. And then, of course, I think one of the things that I look forward to is the old guard is going to be leaving soon, and I think the new guard has a very, very wonderful, refreshing way of looking at things, and which is much more equitable. Unfortunately, I was there with the old guard, but I also would have to say that I had the opportunity, I seized the moments, and I was very lucky with some of my mentors who were amazing and really trusted in me learning that. And to get back, I mean, think about what you did in formal training, coming back to McMaster's, being attached to a research institution in an academic center. Also clips your wings a little bit if you wanted to explore entrepreneurial things and do more financially rewarding career. And I think that part is also something for us to think about. So, but there is nothing more rewarding than answering a research question with a really well designed. This is really important because we're putting patients in it, and there is a lot of, I think, uneasiness there, right? Because I don't sleep well at night. I keep thinking, oh, is that blinded double-blind placebo control? I mean, what's going to happen? I hope the drug works. What if the placebo patients don't do well? Did I ask the right question? Did I design this well? Am I going to have a clear-cut answer after all this money has been? So today is a big day, right? Today
it is a big day for us.
It's a big day for us as women at AHA. Dr. Judith Hochman, who's I've looked up to as a mentor for many. I would call her and ask her about child parenting questions, and she would help me. Has designed one of the most important trials for us in the treatment of patients with stable ischemic heart disease. And she's a woman, she's done it, and I'm always inspired by seeing women like yourself on platforms doing these kinds of work.
I would agree that having role models to emulate really helps inspire and energize you, particularly when there are obstacles that you face in your work environment. You could look to role models for suggestions, but also psychologically find comfort in the fact that others have had the same experience as you and managed to succeed. And so there's always a solution to some of our obstacles. I would say that there are some process changes that are required so that all our colleagues, men and women, and all our trainees have the same chance at succeeding, at getting grant funding, at getting salary support. Some of it may have to do with having objective criteria and perhaps blinding to the sex of the applicants. What are your thoughts on this?
I think this is, we all learned that through exercise, we all have implicit bias. And blinding the applicants, even for journal editors, I believe authors should be blinded, not so that you don't see where the author is recited and who they are, men, women, or also race issues. And I really do believe it's going to do a great service to clinical trials if more women and diverse leaders are at the driver's seat. They'll ask the questions that are pertinent to the diverse patient population. They will be committed. They will do a great amount of work, and it would be great to see grant funding from NIH and governmental funding to more women, so that we don't have this issue of not enough women in clinical trials, not enough women or diverse patient population. So I think it's going to make a big difference.
Right. We certainly have to make some changes in how we recruit patients so that women are also represented within our clinical trial populations. Now, you lead a great organization, Women as One.
Thank you.
Why don't you let us know what your plans are as part of the organizational vision to tackle this issue of inequity and also perhaps the underrepresentation of women in certain clinical and research fields in cardiology?
Well, thank you for that question. And I think one of the things that we will and have already begun doing is to bring together research leaders, work with our societies. American Heart Association has always been extremely supportive of women in research. American College of Cardiology, European Society of Cardiology, World Heart Federation. We all met this morning talking about some of these important research venues and really kind of thinking about how do we make sure that some of the field is open to men and women, And especially to the younger generation of women who really are wanting to. We need to educate them. They need to get training. We need to show that there are more women in those leadership positions, and I think it's going to happen. And
Wonderful.
Women as One will do that.
I cannot wait to see what you accomplish as an organization, and I look forward to working with you to spread the message that all of our trainees can avail themselves of these opportunities, and that we are going to work hard to make sure that equal opportunity is commonplace in cardiology. Thank you so much for joining me today.
Lovely meeting you.
And I look forward to connecting with you again at this meeting, because we're going to talk about ischemia at some point. We're going to break it down for everyone.
Absolutely. Well, thank you. Thank you.